Let's talk about ovulation. Ovulation is the process during a woman's menstrual cycle when an egg, or ovum, is released from one of her ovaries. This is a critical event for conception, as it allows for fertilization to occur if sperm are present. Here's a detailed explanation of ovulation. 1. Menstrual cycle overview. The menstrual cycle is divided into several phases. 1. Menstrual phase, days 1 to 5. This is when a woman has her period, and the lining of the uterus is shed. 2. Follicular phase, days 1 to 14. The body prepares for ovulation. 2. Follicles in the ovaries grow, and one will eventually mature to release an egg. 3. Ovulation. Around day 14 in a 28-day cycle, the mature egg is released from the ovary. 4. Luteal phase, days 15 to 28. After ovulation, the body prepares for a possible pregnancy. 4. If the egg isn't fertilized, the lining of the uterus will break down, leading to menstruation. 2. The ovulation process. 1. Follicle development. Before ovulation, multiple follicles begin to grow in the ovaries due to the rise in follicle-stimulating hormone, FSH. 1. Typically, only one follicle will become dominant and mature, containing an egg. 2. Release of the egg, ovulation. When the egg reaches full maturity, a surge in luteinizing hormone, LH, triggers the release of the egg from the dominant follicle. 2. This process is called ovulation. 3. Egg travel. After being released, the egg is captured by the fallopian tube, where it may meet sperm if intercourse occurs around this time. 3. Timing of ovulation. 1. Ovulation typically happens around the middle of the menstrual cycle, day 14 of a 28-day cycle, but this can vary based on individual cycle lengths. 1. For example, if a woman has a 30-day cycle, ovulation may happen around day 16. 2. The egg can survive for about 12 to 24 hours after ovulation, so conception is most likely to occur if sperm are present in the fallopian tubes during this window. 4. Signs of ovulation. Some women notice physical signs that they are ovulating, including 1. Cervical mucus changes. Around ovulation, cervical mucus becomes clear, stretchy, and similar to egg whites. 1. This helps sperm travel more easily through the cervix. 2. Basal body temperature rise. After ovulation, a woman's basal body temperature, BBT, may rise slightly due to increased progesterone. 2. Charting BBT can help predict ovulation. 3. Ovulation pain, Mittelschmerz. Some women feel mild pain or cramping on one side of their lower abdomen when the egg is released. 4. Increased libido. Some women experience a heightened sex drive around ovulation due to hormonal changes. 5. Changes in the cervix. The cervix may become higher, softer, and more open during ovulation. 5. Factors affecting ovulation. 1. Age. A woman's fertility declines with age, especially after age 35, as both the quantity and quality of eggs decrease. 2. Health conditions. Certain health issues like polycystic ovary syndrome, PCOS, thyroid problems, or stress can interfere with ovulation. 3. Hormonal imbalance. Fluctuations in hormones like FSH, LH, and estrogen can disrupt regular ovulation. 4. Lifestyle factors. Stress, extreme weight gain or loss, and excessive exercise can also affect ovulation. 6. Ovulation and fertility. 1. Optimal time for conception. The best chances for conception occur when a woman has intercourse in the days leading up to and including ovulation. 1. Sperm can survive in the female reproductive system for up to 5 days, so intercourse a few days before ovulation can still result in pregnancy. 2. Tracking ovulation. Many women track ovulation to improve their chances of getting pregnant, using methods like ovulation predictor kits, BBT charting, or monitoring cervical mucus. 7. If ovulation does not occur. 1. Anovulation. This is when a woman does not release an egg during her menstrual cycle. 1. It can lead to infertility and may be caused by conditions like PCOS, stress, or hormonal imbalances. 2. Anovulatory cycles. These are common, especially in the first few years of menstruation and in the years leading up to menopause, when ovulation can be irregular or absent. 8. Post-ovulation. 1. If the egg is not fertilized by sperm, it will disintegrate and be absorbed by the body. 1. The levels of estrogen and progesterone fall, and the uterine lining begins to break down, leading to menstruation, which marks the start of a new menstrual cycle. Understanding ovulation is crucial for women who are trying to conceive or avoid pregnancy. It can also be an important indicator of overall reproductive health.